much. Am I too loud and just right? Everything just right? Okay, it's like Goldilocks and just right. Okay. As Carolyn said, my name is Adelita Cantu. I am an associate professor at UTHealth San Antonio School of Nursing, and many familiar faces here. So I understand there's community health workers here, some nurses, some public health people. Okay, public health people. Anyone else that I did? There was a pharmacist. I'm sorry? Professor in what, sir? Health science? Okay. Oh, okay, wonderful. Okay. So what I'm going to do today, in keeping with our theme of health literacy, is how do I use some tools that are out there to help people understand, particularly in the most vulnerable communities, understand the connection between the environment and our health. And how can we make that connection to increase our awareness of that? And then once we have our awareness increased, how can we go about reducing some of our exposures? So many of the things I have here will be, they're freely available on the internet out there. I'm going to point out some of the tools that you can use when you're talking to residents, when you're talking to community members about how you can help them see the connection. Very informal. Please stop me at any point. Any questions, any comments, be happy to talk with you about that. Okay, so at the basic level, we are all interested in people that are healthy and wanting them to be healthy in the community in which they live. But we know we cannot have healthy people without healthy places. We don't have a healthy place to live. And we cannot have healthy places without a healthy planet. So it's all connected, which is important to acknowledge if we think that the environment does have an impact on our health. So we want to be able to see that connection. Healthy home, we want a healthy home, but we have to have our community healthy, and beyond that, the planet, the world, etc. So my objectives today are, first of all, to describe environmental health, literacy, and its impact on health. Think about some of those public health risks that come along with some environmental issues that are out there right now. The big one is climate change, and it's just basic information that I will be delivering on climate change. I know it's a hot button issue, but I'm not going there. All we're talking about is what's creating the climate to change the way it is. Also, air pollution. I want to talk a bit more about San Antonio just being declared in non-attainment of ground level ozone and what that means for our health, particularly our children and our elder citizens. And then what are some of the strategies that people can use to not only raise awareness, but to decrease their exposures to them. And in turn, helping you talking to community members about decreasing their exposures to it. So, does that sound good? All right. So, first of all, we'll start with definitions. Everybody starts with definitions. So, the environment. What is the environment? It's one of the most fundamental determinants of individuals and community health. Where we live, work, and play determines our health, more so than a lot of other things. When we think about social determinants of health, we always think about where we live, work, and play, but where we do that is in the environment in which we live. Environmental health, then, is thinking about human health, human health aspect by what we physically come in contact with, either chemicals, biological, or psychosocial factors in our environment that we are in. So right now you're sitting at a tablecloth that has been washed in detergent, right? You know what kind of chemicals there were in that. Okay, you get on your hand, and your hand goes to the food you eat, it goes into your body, those kind of things. Those are the things that we want people to be aware of. So that's just an example of what we touch, feel, everything else. So the environment is everything around us. Air we breathe, food we eat, the water we drink. How many of you know what's been happening in Flint, Michigan with the water they've been drinking? Particularly the children, childbearing women with fetus, lead, and what lead then does to the body, particularly with children. But it's also chemicals, radiation, microbes, physical forces that we come in contact with. So again, it is everything around us. So how those interactions with the environment are complex, and they're not always going to be healthy. So that's one thing to take away. Oh, thank you, Carol. I was wondering what was going on. So That's the one thing we want to take away from here is the things that are environment and that we touch, breathe, think are not always going to be healthy for us, and how our body reacts to them. So, health literacy, we all know that. We've been involved in the definitions and all of these things that people use to realize their potential in health situations. We want people to understand that. So, not only taking information in, but how do I process that information? That's literacy, right? Health literacy. Environmental health literacy integrates those comments in looking at our environmental, the environmental literacy, which I'm going to be talking about today, and health literacy. So we're thinking about those comments, using the concepts, using them together. And then we hope that people will develop these wide range of skills that would help them to be knowledgeable about it, but then to make informed choices about how do I increase my exposure to them. And not only me, but my family, my children, etc. So that's kind of what we're focusing on today. Actually, there has been some research, and I just put in this real quickly to show you, there has been some research out there in looking at environmental health literacy as a concept. And the conceptual model looks at everything through the years and has contributed to why we do need to develop some environmental health literacy on this, on the topics of health. So there were technology has become so rampant. There's different things, but there's also a lot more things that we're exposed to through technology. Communication modalities, how do things get communicated? So that's just to show you that there are some streams out there leading to that environmental health literacy. And a lot of it is just based on Bloom's taxonomy. How many of you know about Bloom's? In education, how do you develop your SMART goals and objectives and everything else? So how literate, there's measurements out there of how literate individuals, communities are about environmental issues around breast cancer, around autism, around asthma, environmental justice, pesticide exposure. We have no idea if they've sprayed in here at all with insecticides, right? Although we don't see any bugs and things like that, I'm assuming they have, but then we don't know what's in the pesticide as well. So when I go out into the community, particularly the most vulnerable communities, I want to know at what level of environmental health literacy or what level they understand these concepts, like breast cancer. What are some of the things you know in terms of breast cancer that you've heard can be attributable to the environment? Anything? Just knowing breast cancer, we talked about breast cancer, what is out there in the environment that could be a contributing factor to breast cancer?
Alcohol.
Alcohol. Alcohol? Anything? Sugar. And links to obesity. Obesity. Mm-hmm. Anything else? There's been some connections between the chemicals and the pesticides that are being used and breast cancer. There's also some links between what we call obesogens, those things that are causing obesity, and a lot of that is in the environment around us and the foods we eat and everything else. So when I'm out in the community thinking, okay, how can I increase awareness, is what level of awareness do they have? So a lot of work has been done on understanding, do we first need people to recognize that there is a connection? And then how do I understand that connection and how do I apply it to me? So there is some evolving work on understanding environmental health literacy. And so that's how I began my work in helping the community understand those connections. And the first one I start out with is climate change. And I always call it Climate Change 101. Because it's very complex. And people many times don't have a basic understanding of what we're talking about when we say climate change or how global warming is happening. So I always start out with a little presentation on Climate Change 101, which is basically looking at the Earth and the atmosphere. The atmosphere is around the Earth. And how many of you remember your science? What's the atmosphere made of? Or the layers? Gas. Come on now. Okay.
Gas.
Gas, okay, what kind of gas? There's two layers that were particularly ozone. There's ozone way up here in the atmosphere, and the stratosphere, So as you can see here, the atmosphere is actually pretty thin, you know? So the atmosphere, when we look up and we see the blue sky, that's the atmosphere. And beyond the atmosphere is this whole outer space out here. So actually the atmosphere is not very thick at all. So when you think about that, and then you think about the sun, so what happens is that radiation from the sun comes to the earth, and it's in those forms of those light waves. We always see that, and those are the things that cause us to have suntan, or to get tan or get sunburn or whatever is those light waves that come from the sun. And that's a normal process. It passes through the atmosphere to warm the earth. And the earth needs to be warm. Most of the radiation is absorbed by the earth, right? And it warms it, which is how we all survive. We need the warmth of the sun. And then what happens is that some of the energy is absorbed by the earth, but some of it goes back out into the atmosphere, goes back out through the atmosphere, and goes out into outer space. So that's the normal process. That's what we want to happen. That's what we want to happen. But because during climate change, the atmosphere starts getting thicker, so where it started out very thin, it's getting much thicker, a lot of that radiation goes back out to space, cannot do that. It comes back down into Earth, and it continues to warm the Earth. So it's trapped in the Earth because of the thickening atmosphere. So that thickening of the atmosphere is problematic for us because it continues to warm. The Earth. Where does most of that heat go? When it's Earth. Anybody know where most of that goes? I'm sorry. To the ocean. Okay, it goes into the ocean. So when you trap heat, most of it goes into the ocean. So when you're boiling water on the stove, what happens to the water? It evaporates. What else? Think about what happens when it boils. What does it do? It bubbles. And so it expands, right? It expands. So as you heat up things, they start expanding, they start getting larger. And so when you think about that and you start hearing about sea levels rising, some of that's what's happening is that it's going into the oceans, it's raising the sea level from that, and then that can cause a problem for us because of those rising sea levels. So those are some of the things that you will see. But that's where most of the heat goes into, is in fact the ocean. Somebody said that it evaporates. Who told me that it evaporates as well? Somebody said evaporates? So it evaporates, and so when it evaporates, the water goes back up, right? And so what happens when it goes back up? It'll eventually come down. And that's why we're having those intense rain events, because the water is just right up there in the atmosphere and the clouds and everything else. So the water is being collected there. We'll talk about that a little bit more. And then it shows more and more as the atmosphere gets thicker, more and more and more of the heat is trapped into the earth. So how come it gets thicker? It's because of what that we call greenhouse gases. You know about that, greenhouse gases. And people, sometimes greenhouse gases, what does that mean? So green, that's good. Usually when we hear the word green, that means it's healthy, it's organic, or whatever. And so these are greenhouse gases. And so it doesn't make sense they would be necessarily bad. So what are the greenhouse gases? And those are things that just come from things that we do as human beings, and they go into the atmosphere and they help thicken the atmosphere. So flying. How many people flew to get here? Did anybody fly to get here? No? Okay. Oh, where from?
Vancouver, Canada.
So you came a long way. Well, welcome to Texas.
Thank you.
Came a long way. So air transport, all of those emissions that go from that. Oil production, because when you produce oil, you use a lot of the things that will emit into the environment. The things that are important to us here is agriculture, because we have a lot of farms and ranches around here. The agriculture also is a problem from emissions. Does anybody know where those emissions come from agriculture? The cows. Yeah, is that what you're going to say? The cows, yeah. So methane is released from the gas released from the cows. Those are the methane that goes up into the atmosphere as well. So that is one of the atoms, methane, that actually traps more heat than even carbon dioxide. So that's why when we hear methane, it's even more of an issue than carbon dioxide is. But that comes from agriculture. Land transportation, we're going to talk about that when we talk about ground level ozone. Coal mining, thawing permafrost is another issue. Anybody know what that means, the thawing permafrost? Yes?
Like the ice caps melting?
The ice caps are melting, we're trapping heat into the earth, and so the ice caps melt. And then it not only raises sea level, but because gases have been trapped in the snow and the ice for so long, those are also being released into the atmosphere as well. So just a whole bunch of things that when I'm talking to people to understand the things that we do and the things that we do as humans are also contributing to those exposures, or I'm sorry, those emissions that get into the atmosphere. We haven't had any fires near us. The closest one I think was that one in Austin. What was that? Bass Rock, thank you, Bass Rock. But the carbon dioxide that comes from forest fires are also an issue that releases carbon dioxide into the environment. So when you think about environmental health literacy, it's important for people just to get a basic understanding when we're talking about emissions that go into the atmosphere. Where are those emissions coming from? And then more so, am I doing anything that contributes to those emissions as well? So now we talked about some of the things that happen because of global warming. But this slide just kind of shows you that the largest source of global warming is the burning of fossil fuels. And you can see since the Industrial Revolution how high the amount that we're releasing into the environment, which makes sense because we've been growing, we've been, as human beings, we evolve, we do things better, we create more businesses and everything else, but carbon dioxide, which is a potent greenhouse emission, is being released into the atmosphere faster than at any time in this 66 million years. So more and more is getting it, more and more the atmosphere is picking it up, more and more heat is being trapped. And the largest source of global warming, like I said, is fossil fuels. That was the same slide. I'm sorry that this was another way of showing that. So we've got the situation of heat being trapped into the earth, and we know now that it seems like summers are getting hotter, right? The summers are extending longer. I mean, it's October, and it's probably going to be 90 today, maybe a little bit more. So what this shows is that the normal bell curve, we're all familiar with the normal bell curve, those things happen as a normal bell curve, but what's been happening over the years is that it's been moving to the right with more intense heat. So it's another way of looking at how we've been moving to those very, very intense, extremely hot days. So think about heat being trapped into the earth, right? You get evaporation from that, so things going up into the atmosphere. And so things are going to get hotter and get it for a longer period of time. So those intense heat events, we see more and more. And then we've got to start thinking what happens when you have more intense heat events. And this kind of just shows how the heat is moving. It becomes more and more hot throughout places in the world that have never been hot before. Okay. Any from San Francisco? Anybody here from San Francisco? California, Northern California?
I lived there 20 years.
Okay. Do you remember this when it reached 106 degrees over there? That was September 1st, 2017. That was last year. It's 106 degrees in San Francisco, Northern California. So one example of extreme heat there. Huh? Very abnormal for San Francisco. But in Australia, almost not too, pretty far away, 117 degrees in parts of Australia in February. So another example of extreme heat at various places in the world. You got San Francisco, you've got Australia over here. Temperature in Turkey, 113 degrees, July 2nd. That was last year as well. I'm getting hot just thinking about it, right? This is Kuwait City, 124. I know in San Antonio, I don't think we've ever been like that, but Arizona does come close. I haven't seen it that yet. Maybe 118. Yeah, I've seen those like in Las Vegas. Yeah. Birds in the city died and fell from the sky from that exposure, and that was in Kuwait City. Reagan National Airport. Tires were melting because it was so hot. So again, when you think about climate change and how it impacts us, but think about how it impacts our ways of getting around. If they do not do something in terms of making the asphalt resisting to that high heat temperature, we're going to be seeing more and more of this happening. So it's another discussion that climate change is moving us to become more adaptable and resilient to that as well. So doing something to the asphalt so this won't happen in those extreme heat days. United Arabs, 124, is getting close. Yeah. Here's this one in Turkey that had to be, the road actually melted because of the extreme heat. $123 in India. So it's all over, again, just to show you all over the world. In India at this point, they had to distribute water. Because remember, evaporation, things evaporate when it's extremely, extreme heat is very high. A lack of water, low water, the government having to distribute here. So let's think about droughts for a while. What are the things that happen when there's a drought going on? One is there's water restrictions, right? SAWS is really good at, SAWS is our water public utility. And they'll put in the restrictions right away, 1, 2, or 3. They'll put in those restrictions really, really fast, which is good because they help us conserve water. But think about it, when you've got extreme heat going on, everything's being evaporated. Even the water in the ground is being evaporated up into the atmosphere. And so that leaves a very dry ground, very hard to grow fruits, vegetables, things like that. So it may have an impact on our food intake as well. And in Texas, we definitely are experienced with droughts, right? I mean, we were in a drought until we had the rain of this September. But then in the rain of the September, when you think about some of those intense water events, actually we broke our all-time record with all the rain that happened in September as well. So not only are people not getting enough water, but the ground is losing water as well. And so that contributes to the droughts that we see in places in the world as well. Another one in India, now we're talking about the health part of it. 2,300 people dying in their heat wave of 2015. So now we're starting to talk about people being affected, not only with dehydration, but also dying in these extreme hot conditions. And who are the most vulnerable for that? Children, older, immunocompromised, all of that comes into being place as well. 124 in Baghdad, the government declared a holiday to prevent people from working in the heat. You always feel that for those people that do work outside, when it gets really, really hot out here as well. And we think about dehydration, thinking about all of those things that happen. Another instance where they had 1,200 people dying. This past summer, we had a heat wave in Europe. And in all of Europe, there were about 3,000 deaths from that heat wave in Europe. So in the future, the climate in large parts of the Middle East and North Africa could render some uninhabitable, which will surely contribute to the pressure to migrate. So thinking about the connection between environmental health, what's happening with the climate, and health, as well as civil unrest, because there is some migration that's happening from the rural areas because I can no longer grow anything because of the dry conditions. So I'm migrating into the cities, and the cities are saying, no, we don't want you in here. And so it's creating a lot of that civil unrest and civil tension. In fact, there's a large body of research that associates the civil unrest that's going on in Syria with all those rural individuals moving into urban cities. So even the migration and civil unrest does have some foundation in things that are changing in our environment. Another way you connect the two. Extreme heat waves. Some thought about that it would eliminate human survival, and it will become normal in the Middle East if carbon emissions are not significantly reduced. People just won't be able to live there. So this is where we talk about. Now let's get into hurricanes, and that is important for Texas. How many people are here from Texas? Okay, so we just had Florence that happened, but of course Harvey of last year. In fact, on Monday, I'm going to be going down to Rockport because we're still doing some hurricane relief, even a year later, out in Rockport relative to health screening and getting people that are unserved in there. So as temperatures increase, oceans start getting, evaporate more moisture into the air, and just kind of just shows that happening. So the downpours get bigger. Any of you been caught in any of those big downpours? Yeah, where at? In Mexico, yeah, the big downpours. So they keep happening now. And why do they keep happening? We have all the water up there. And so what you will see are big downpours like this. This is in Arizona in 2015. It all comes down at once. So if you have an event up in the atmosphere, like a cool front coming down, it's going to mix together, and it's going to create the disturbance, and all of the rain will come down at one time. And that's what we've been seeing a lot as well, is more rain. Leads to more flooding, leads to more standing water, more mosquitoes, more vectors coming in, and creating a problem with public health as well. And this is another one in Phoenix. Then let's talk about Harvey. Anybody from Houston? Okay, were you there with YouTube? Were you there with Harvey? Yes? Yeah, okay. So 33 trillion gallons equals to Niagara Falls for, that's equal to the flow of Niagara Falls for 509 days. Have you ever been to Niagara Falls? We did a couple of years ago. It's beautiful over there, but the water just never came down. That's how much water was coming down in Harvey. It's beautiful, but if it's not controlled like that, so more storms will be coming up. Increases substantially. The result is from global warming. So how does it impact hurricanes? And again, because we live in Texas, all of our coastline is very vulnerable to it, as well as places not too far from the coast, as well as we saw with Houston. So the warmer oceans lead to more intense hurricanes. Hurricanes feed off warm water. Hurricanes intensify more rapidly. We've had more category 4 and 5 hurricanes. And then warmer air holds more moisture, which we've talked about that. And then the storm surge increases due to sea level. And so in the one that just happened, Florence, no, what was Hurricane Florence? What was it in, where was Hurricane Florence in? On the East Coast, right. And they were saying the storm surge is what was the most dangerous because all that water coming over there and coming into it and creating not only the flooding, but where people get trapped is the storm surges. So again, all contributing to, in Houston, what I've heard is for the last 3 years, they've had 500-year floods in Houston. So this one in Harvey, 1 in 25,000 year flood. In some areas, it was 1 in 500,000. And many of you saw these pictures from Harvey. So, you know, in this nursing home, they were flooding, and there was a social media post of it. You know, we need help. We need help. And in fact, they did come to the nursing home. They got all of the seniors out successfully. So it was a very good story in that way. I think even there's a cat in here. Somebody also got out. Yeah, well, which is good. So just pictures of how it impacts humans. They're getting the dogs out too. The animals are coming out. But it just shows you how long did it take them to clean that up. Still working on it. Yeah. Not too far from Houston, 60 inches of rain. It's the greatest single storm of rainfall ever in the United States. So, climate change, getting hotter. The issue is impacting human health. How does it impact human health? We saw just some of that. But remember, when you have a lot of water, and I know we have a lot of public health people here, you have a lot of standing water, what happens?
Mosquitoes.
Mosquitoes. What do mosquitoes carry? Zika's one. West Nile. Dengue, all of those vector illnesses, diseases that come into human beings. So we know that mosquitoes can certainly be an issue right now. I understand North Carolina is having this very, very significant issue with mosquitoes. But we talk about the West Nile virus. So are we anywhere near the Nile River? Nope. But what has changed is the atmosphere and the environment in which they flourished in the Nile River. It's now happening here. So the mosquitoes are migrating over. We're seeing more West Nile virus as well. So and certainly that, just having intense rain is going to keep that continuing. Hot days, dehydration, people that work outside. People that work outside. And the people that work outside are who? City workers, construction workers, you've got your people that may be undocumented, you've got all those many times very vulnerable populations that work inside because of limited resources, they can't find a job anywhere else, and so again, the most vulnerable are, that can be very problematic to them. So many of them work very early in the morning or very late at night or working through the heat as well. So those climate change issues that are impacting human health. I just want to spend briefly on hydraulic fracking because here in San Antonio, we're next to the Eagle Ford Shell, which is in the Karnes City area, around that area. So that's also contributing to human health because of not only the chemicals they use, but also just the process of doing it. So this is just a quick picture to show you that what they're doing now is breaking up the shell underground to get to the gas and oil that resides in the rock. So they break it up and then it comes back up, and they're using that for natural gas and oil. But in the process of doing that, they're actually using tons of water to push those chemicals through and bust up the rock. So not only are we losing water because of climate change, but also having some of this going on, which also is using a lot of water. But there's a lot of chemicals mixed in that as well. So when they're finished fracking that shell, the water all comes back up that have the chemicals in them. And now what they're doing is they're injecting them back into the earth, or they're making injection well pits. So they're just right there on the surface, but all that water with chemicals is sitting right there. And this is more significant in the rural population because that's where it's happening right now. So those individuals are faced with the exposure of the chemicals, not only from just water sitting on the in an injection well pit, but also when the water goes back down, it's associated with a lot more earthquakes. So when you hear about those earthquakes happening in Oklahoma, maybe in West Texas, it's not necessarily the fracking that's doing it itself, it's sending the water back down. So again, impacting human health, but the most vulnerable because this is happening in the rural communities as well, where you have people who have limited resources, who may not be funded through their with health insurance, and actually who have very limited health clinics to go to as well. So another issue that's contributing to climate change in terms of heating up the earth. So we've talked about some of the impacts of climate change on human health, and I always use this slide because when I'm talking to people in the community, you always want to, well, what does it mean to me? What does it mean to me? How do I connect the two to it? So I always like this slide. It's from the CDC, and I will share it with anybody that wants it. It's on the CDC website. So you've got rising temperatures, which you talked about, You've got more extreme weather conditions, particularly rain and the drought and the intense heat. You've got the rising sea levels and all those CO2 levels rising. So all of those things are combining now to have an impact on health in many different ways, and we're going to talk about some of them in a little bit. But definitely air pollution, and that's pretty significant with what's going on in San Antonio right now. We've talked about severe weather, extreme heat, but just the degradation of the environment. We talked about more people in the rural areas coming into the urban areas because they can no longer farm or raise cattle, leading to civil conflict, more mental health issues because they're having to move. I hate moving. You all like moving? I mean, I just get so depressed and oh my God, I got all my stuff together and I just don't like it. Malnutrition, diarrhea, cholera. Now, not necessarily here in the United States, but all of those hurricanes, and I think it was earlier this week a tsunami in Indonesia killed almost 1,000 people, I think, at this point. But what happens when you have that is that you also have a break in the sewer systems. You have a break in the sewer systems, you have more cholera. Think of all those earthquakes in Haiti and other environments as well. We're going to talk about increasing allergens. What happens when you have those intense, we talked about the intense rain events. What do we all love here in San Antonio? Mold. So you got more mold going around in the air as well, just because of it's raining and the standing water, and that's mold. And then changes in the vector. We talked about vector as well. It talks about malaria. Now, here in the United States, there has not been an increase in malaria, but certainly around other places in the world where malaria is very frequent, you see that. So, when I'm talking to someone in the community, the ones that I really focus on that we all live is extreme heat. So people know what we're talking about with heat, because how do you feel when it's so hot? But I also talk about these increasing allergens and air pollution, because I think it seems to me as I talk in the community, these are the real hot button issues because it's something we can see and feel and where it gets sick. It gets us sick or it gets our kids sick. Yes, ma'am?
I just wanted to share that one of the studies that we're doing in mental health quality shows that our ozone levels are highest on days with very little wind, which means it tends to stagnate over the city.
Right.
And ozone is very much in connection with high asthma rates in children.
Right.
Which of course has an impact on their attendance in school.
Right, I have a slide on that, but you're exactly right, because the ozone just kind of sits there on the ground, not the ozone that's in the environment, it's the one on the ground. So I have found that this is just talking about useful things, strategies that you can use. I have found this slide really, really helpful because people can see it, because I live the heat, I live the rain, I live the allergens, and this is what it means to the health and making that connection to them. And so, again, I'll easily share it with you, but it's on the CDC website as well. So there is a human impact to it. So this is from the World Health Organization because it's a global issue, not just here in the United States. Water quality and quantity contribute to a doubling of people living in water-stressed basins by 2050. Food security, like I said, agriculture, people can't farm any longer. People can't raise cattle anymore, so their food security is becoming an issue worldwide. And control of those infectious diseases. And then how are we going to protect people from disasters? Particularly if you live near the coast or on the coast. Anybody here from Corpus, the coastal region? Where are you at? I'm sorry, Maryland? You lived that 60 inches of rain, huh? Okay, right. So there's a lot of efforts right now, not only in San Antonio, and our city is right now, our city and a lot of us are involved in a climate action plan. How do we make San Antonio become more resilient to these disasters that we know are going to happen? Right now, some of the coastal communities are actually raising the city. So Florida, Miami, even when it's not high tide, the water is going into the city. So right now they're spending money to actually elevate the city to come up because of the flooding that will happen. So, and that's going to be money, that's going to be a long-term thing, but how do we protect people from those disasters coming up? Because the people that are in these disasters, we saw it in Katrina, we saw it with Harvey. Who is most impacted? You saw it on TV with Katrina. The elderly, the people can't get out, African Americans, all people of color, people that don't have any way to get out or evacuate, are the people that are going to be most vulnerable to disasters that occur. Some of the largest disease burdens are climate sensitive. So each year they're under nutrition, diarrhea, malaria, all of these things that we see here that kill a lot of people, particularly children, people that are older, have their roots in climate change. And more weather-related disasters that are going to be happening. And a connection with poverty, people that live in poverty. Again, we talked about them being the most vulnerable. Okay, so then it's like, when I talk to people, like, oh my God, we're going to all die. You know, right? We're going to all die. What can you do? Well, it's a big issue. It's very complex. San Antonio right now, we're working on an adaptation plan that's involving a lot of people, coming up with some of those things that'll help us in the future. But what can you do? You know, I always start to talk about some of those small changes that we can all do. Just to feel that we are doing something, but it does make a difference. This is one website I use in terms of helping people think about their carbon footprint. And what does that mean, carbon footprint? Why should I reduce my carbon footprint? And all of those things. So I use this website to help them understand the carbon that we use and how we can then limit that, or at least bring that down, or think about it before we actually do that. How do we be greener at the office? For me, as nurses in the Alliance of Nurses for Healthy Environment, we have a whole section on greening the hospitals. Anybody here work in hospital settings? No? Okay, there's a whole section on greening the hospitals. We use so much plastic in the hospitals right now. How do you think about greening that? Change how you get around. How many of you have done those new scooters? The bird scooters? Is anybody? Nobody's trying them? Yeah, I mean, I see it, many times. Even where I live, right, I'm not too far from St. Mary's University. I'm even seeing them. It's not just the downtown area. They're coming out into the, outside of downtown. So that's just another way of getting around. Why? And we'll talk about ground level ozone, but just another way to avoid those emissions. Getting the new light bulbs and voting. Holding our elected officials accountable for that. Start talking about some little bitty ways. Also, for some of you that work in the community here in San Antonio, CPS Energy has that weatherization program for people that do qualify for that, where they can help their homes become more energy efficient. So that's another thing. So it's not all necessarily doom and gloom, but it's also important for us to be aware of what we can do to contribute to that, and also decrease our emissions from that, or our ways of getting around. Try the scooters, they're really fun. Wear the helmet though. Okay, so let's talk about ground level ozone. Any questions? Like I said, I'll be free, if you need any slides or whatever, but we did mention ground level ozone. So I know we have several people here from the city. The city has just been designated in non-attainment for the ground level ozone. So that means our ground level ozone is higher than what the EPA wants urban cities to be at. So it's too high under this new standard that the EPA has. Now there's some political action that's going on, whether they want to sue the EPA, where Texas wants to do that. But right now, San Antonio is having a problem with their ground level ozone. So what's important here, you've all heard about the ground level action days, ozone action days, right? Okay, so why do I need to not gas up my car, things like that? Well, basically ground level ozone is a chemical reaction. When you have a lot of sunlight coming on, it's really baking, like in summer, sunlight, then with the emissions from the cars that we drive, which are what we call nitrous oxide and volatile organic compounds. When they combine with the sunlight, then you get ozone. You get ozone that stays on the ground. Doesn't go up into the atmosphere, which you want it up there, you don't want it down here. And so that's what's happening. So the pollutants will bake together in direct sunlight to form that ground level ozone. So San Antonio is a non-attainment. So what do you think is happening in San Antonio right now that's contributing to this? I mean, I'm picking on San Antonio just where we live. How many people live here in San Antonio? For quite a number, okay? Increasing the population. So we're expected to have another million by 2040, I think they're saying 2040. How are all those people going to get around? And then where are those people going to live? And how far will their commute be to work? And you know, so you've got more cars on the road. You definitely will have more cars on the road. So what else? And then another thing, it just.
We don't have a really good efficient transportation system for the cities that have subways.
Yeah, we don't have a high-speed rail, we don't have a subway, we don't have elevated train systems or anything else. So people are on the road in their cars releasing some of the emissions, okay? Anything else? And we have a lot of sunlight here. We have a lot of hot sun, we have a lot of sunlight. So, you know, when those ground level ozone action days are being called, the recommendation is to limit your driving, right? Try to limit the driving as much as possible. Only fill up after 6 p.m. when the sun has gone down, because now you know there's a chemical reaction that the sun has to be present. So you want to do as much as possible in loading up your car with gas after the sun goes down. And then if you're one of those most vulnerable, you want to try to stay indoors as much as possible, particularly at the hottest part of the days. And so I use this kind of picture to help people understand what's going on, why are cars such a problem, and then why is it such an issue for people that are in the most vulnerable categories. So ground level ozone. And what does ozone do? Particularly, basically your breathing problems. Your asthma, your allergens are in the air. Children are at the greatest risk because of their developing lungs, and they're exposed to that ozone, so it has a very negative impact on the respiratory system. Coughing, difficulty breathing, shortness of breath, you know, all of those things that have to do with the respiratory system. So it has an impact on me, and it has an impact on my children. It does increase mortality, especially among the elderly. Cardiovascular disease, respiratory disease, asthma attacks, school and work absenteeism. Now, one of the things I want to focus on is cardiovascular disease. So why are those related? Those volatile organic compounds that I talked about also you breathe them in, it stays into your arteries, and can have an impact on the blood that's going through your arteries as well. So they get to build up there as well. So if you already have cardiovascular disease and you add more compounds there, it can really have a negative impact. So San Antonio, we're not in non-attainment. The ones I want you to focus on is think about the fact that our pediatric asthma hospitalization rate in Marion County was over 170% of the Texas rate. Think about that. So of all of Texas, our rate is way high, but 170% more. At least 3 children per classroom will have asthma. Again, the most vulnerable children. Children with asthma in Marion County miss an average of 7.6 school days a year. The more absent you are from school, the more likely you will not be academically successful. And if I miss more and more days, sometimes I'm just going to go ahead and drop out of school. So it definitely has an impact on your future economic ability. And then, of course, children living in poverty or disproportionately affected by asthma. What do you think is why? Why would people living in poverty, kids living in poverty, be more of an impact? Preventative medicine, checkups may an issue. Plus, I can't get medication if I don't have insurance, and you have asthma or you have respiratory problem. Sometimes, think about emissions from the cars. Many times people that are most vulnerable live near highways. They're going to be exposed to more emissions from the cars as well. So all of those factors are going to contribute to that. Most children attend public schools in the 4 zip codes where asthma is highest in San Antonio, and it's on the rise. The prevalence has increased 4.9% from 4.9 to 7.4. The city has just funded the South Texas Asthma Coalition, which will be using a model for asthma management among the most vulnerable, with using community health workers, going to home and helping parents manage that more so. So that statistic helped get funding for this, but unfortunately it took that, it had to be the statistic out there, which we don't want, but it's out there. So how do you tackle emissions from the cars? Stop driving, use the scooter, right? Well, next time you're at McDonald's and you're idling your car in the drive-through lane. So this one I use because people really don't think about it when I'm sitting there in my car idling at a drive-through window, the bank, the ATM. You're releasing emissions into the environment, and that's why during those ground level ozone action days, the more you idle, the more it's contributing to the ozone that's just staying in the ground. So this is a slide I use a lot just so people can raise their awareness. Oh my God, if I just turn off my car. But if I turn off my car and it's 110 degrees outside, what happens? So that's always an issue that we always start having a discussion about. Well, could we turn off the car and get out? Could we just sit outside and wait? All those discussions. Or even better, can I stop my car, go into McDonald's and get my meal, and then come back out and start my car up again? So we have, having discussions around that. I mean, and sometimes actually I can get my meal quicker if I go inside than being in the drive-through window, right? Especially at McDonald's. They say like 75% of their business worldwide comes from their drive-through windows. It's amazing. It's amazing. But so those are the beginning to have those discussions to help people raise their awareness of what I'm doing contributes to this ground level ozone that's out here as well. And the more ground level ozone, the more impact it's going to have on my children. So making that connection. San Antonio, 2 years ago, or maybe a year and a half ago, as of January 1st, 2017, the large trucks, there is an anti-idling ordinance. So they're trying to get the big trucks to also be aware of not idling as well. So just to be aware of that. So San Antonio is recognizing that we have an issue. There's also some resources that can be used, because how many of you have children in school? Yeah, so there's several of you here. Okay. Do you go and pick them up, or do you take the bus home or to the school? Or wait to pick them up? Pick them up. How many here pick up their kids from school? Do you idle your car?
No, I get down.
You get down, okay. Because Read Today, Essay Tomorrow is one big push from the city. They're trying to get parents to recognize at the school when you're sitting there waiting for your child and idling your car. So raising awareness, they're trying to do it through the children in school, trying to make their parents helping them make them aware of that. So what could you do instead is, again, get out of your car, or they could take the bus home, or maybe they can walk home with other parents, whatever in terms of some ideas for that. But this is another way that I talk with people in the community is think about where is it that you idle? Where is it that you idle? And the school raises high to the top. And this is something that just came out that now the Trump administration is saying they want to lower the emissions or the regulations on emissions for cars as well, with the acknowledgement that we know that it's going to cause a premature death, but they want to do it anyway. Okay, so that will where this premature death would come from. More emissions, you've got more respiratory problems, and it goes on from there. So people do need to be aware of what's going on. Now, in the last 2 weeks, you can now be exposed to mercury. or that mercury is not, they want to revamp it to how the government values human health, in that they're not going to necessarily take human health into consideration when they lower some of the regulations. So in that respect, it's up to us to understand that human health is still very important in terms of what's needed in the environment. And now this week, the EPA is now saying that you can have a little radiation and it's good for you. I still, I thought I had an X-ray for my wrist yesterday. I told him I'd like the lead shield, obviously. So I'm not sure if I'm there yet, but again, this is why we need to increase awareness, because these things could be happening and unbeknownst to us. Okay, so lastly, I want to talk about chemicals. We're at 2:30, so y'all want to get up and stretch, or this is long song. I don't want anybody to. Y'all okay? They're good. Okay. Chemicals. Around this every day. So there's only one governmental regulation on toxic chemicals, and that's called the Toxic Substances Control Act, known as TSCA. It's been in existence since the 70s. It was recently upgraded 2 years ago by our federal legislation. But right now, think about these numbers. 62,000 chemicals that are being produced were actually grandfathered in to the TSCA regulations. That means they did not have to be tested. We just went ahead and grandfathered them into this regulation. They were safe unless proven otherwise. 87,000 chemical compounds of unknown toxicity to be legally used in food, beverages, packaging, clothing, fabrics, blah, 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 all of those things. So again, we're exposed to chemicals all around us. Only 250 have been required to be tested. And only 5 in the United States have been partially restricted. Not restricted, but partially restricted. In Europe, it's much more. They're more restrictive, so there's more chemicals that are banned. But this one, even asbestos, actually is not banned here in the United States. So it's still being used. And again, our federal government right now wants to loosen the regulations on asbestos so that it can be used more in buildings, etc. And asbestos has those fibers that get into our lungs that create the lung cancer, myeloblasoma. So, just kind of an overview on where we're standing at with chemicals right now. So in December 2009, the EPA updated the list to include chemicals of concern with the following characteristics. They're persistent, they're bioaccumulative, and endocrine disruptors. And these are the 5 right now that the EPA is showing they're chemicals of concern. They're still out there. There's no regulation on them, but they're chemicals of concern. So who are they of concern to? You know, I want to know, for people in the community to know that they need to be of concern to you. And we need to know what we're eating and drinking and everything else. So if you think about phthalates, anything that's flame retardant, anything that's, that what makes something flame retardant are chemicals. And water repellents, all of those things are chemicals. Epoxies, antimicrobials. So all the sanitizers, tricyclone is what is in the antimicrobial that can be a chemical of concern. So if you get a hand sanitizer, that's something to look for that's not there. And they do make hand sanitizers without that chemical there. All of these other ones that are in vinyl products, PBDEs, fluorocarbonated chemicals, and the BPA. The BPA, anybody want to tell me about the BPAs? I'm old enough to remember the movie The Graduate. Anybody old enough to remember that? Okay. Plastics, go into plastics. Yeah, plastics. So when you go to the store and you buy Tupperware or something like that and it says BPA free, that means it does not have BPA in it. BPA is what we call an endocrine disruptor. Now, I spend a lot of time in the community talking about endocrine disruptors because of what it does to particularly childbearing women and children. So what it does is mimics endocrine. That chemical there that makes the plastic mimics endocrine. So endocrine, what happens with endocrine? We become, it's important for our puberty, it's important for a lot of different things. Breast cancers can be more virulent that are founded on our endocrine, that are endocrine growing cancers. So what will happen, the more we are exposed to BPA, the more endocrine mimicking is happening in our body. And some of the consequences of this is seeing girls younger than preteens having menopause, I'm sorry, having their periods, starting their periods, more obesity, more cancers at a younger age, virulent cancers at a younger age have been associated with BPA. Not a cause and effect, but the association as well. And so when we talk about chemicals of concern, these are concerns for us. So when we talk about plastics, BPA is in the plastics. And BPA becomes a problem when you put that Tupperware in the microwave when it combines with heat. So rather than putting that in the microwave, the plastic, taking something out and putting it in a ceramic plate or things like that. I talk about that with people. What are ways we can lessen your risk of that? In your car, water bottles with the summer heat, BPA leaks into the water, and you drink the water. So the one thing I want people to go away with when after this talk with them is don't put plastic in the heat. That's one thing. You can't get away from BPA because it's all around us, but you can minimize your exposure to it by not making that chemical reaction that gets it leaking into the food and into the water. So with the endocrine disruptors, I spend a lot of time because I talk to a lot of children, young children, teens, as well as childbearing women, and it becomes very, very significant for them. So BPA, so I wanted to spend some time on that. These are some of the, like I said, partially restricted. You've got chemical concerns from our EPA, but you do have some resources out there like the Institute of Living Future. Their website actually lists more chemicals that are of concern. And so this is a strategy you can use to let people know, looking for these chemicals. So that's one. And as you can see, it lists a lot more. How does it get into your body? I use this picture a lot as well because, particularly with kids. So you can get chemicals into your body through inhalation, breathing things in that, because that's the problem with asbestos. You breathe in, those fibers get trapped into your lungs. But you can also ingest it, and then you can it also is absorbed through your skin. That's why I'm saying you're just touching this, you don't know what's being absorbed into your skin. So those are the three ways chemicals can get into your body. Now think about the most vulnerable. Children, what do? They crawl on the floor. Everything goes in the mouth, right? And they're spending a lot of time on the floor. They're spending a lot of time eating dirt, things like that. Everything goes into the mouth. So you can see why children become one of the most vulnerable in terms of the three different ways that chemicals can get into your body. And the issue with children is that organs are still developing. Lungs, brains, everything are still developing. So when I have those negative exposures, like from lead, that's where some of their issues can come from. Just a picture showing us some of the risks where BPA comes from, arsenic, formaldehyde, all of those things that are out there with chemicals. And this one I use just to show what can be in issues of, with asthma, what causes, or what we call asthmatogens, so that they do contribute to asthma examination. Look at the dust mites, cockroaches, rodents, moles. So again, just another way of looking at reproductive toxicants, things that negatively affect reproductive stages. Just another way I show people that there's some dangers out there. But then we talk about the exposure. Well, so what if I'm exposed to it? Well, these are some of the things that those chemicals are known to contribute to. And again, with a BPA, we talk about reproductive system abnormalities, but look at mercury. And remember what they're trying to do is lower the regulation of mercury, but for kids, there are neural tube disorders as well as behavioral problems. Tobacco smoke, low birth weight. So does anybody here work with prenatal care? You know, a lot of that low birth weight comes from tobacco smoke. Things that have happened in San Antonio. In San Antonio, you know, convenience stores, they can no longer sell cigarettes to anyone less than the age of 21, right? And well, think about that secondary smoke as well. So now we're not exposed to as much because there's a lot more regulation on where you can smoke and where you can't smoke. And then this is another slide of things that are out there. And let me see, see if it'll let me do that. Yeah. So I show this to my students as well. So this is Skin Deep from the Environmental Working Group. So what I asked them to do is type in a product, a personal care product. What do you want? What do you want to type in? Who uses a shampoo here?
Jergens lotion.
Jergens lotion, okay. And what it's going to give you is a rating. So if you use the Jergens Daily Moisturizer, you're at hazardous zone, you're of moderate hazard. So if you want to look at your personal care products, which a lot of them are made up of chemicals. So if you want to look at, this is a really quick way to see if there's a high hazard or a moderate hazard to that based on the chemical there is. Lubriderm? Is that's a lotion?
Oh yeah, that's what my doctor recommends.
Okay, sure. Okay, you're here, well, there's different products. So they go range from anywhere from a 4 to a 7, depending on which one exactly they're wanting you to use. Number 7, hopefully it's not number 7. Lubriderm Advanced Therapy Lotion Extra Dry Skin Moisturizer. So it's at a 7.
And what is this website checking for?
It's Environmental Working Group. That's the organization that's called Skin Deep.
What is it checking for?
The chemicals that are in the personal care products and what they're rating as low hazard to high hazard.
In the product themselves, not in the bottle or?
In the bottle, no, in the product itself. Good point, because if it's plastic, it'll be the BPA as well. It's a 7 to 10 on this one, so it shows in that. Now, then hopefully then when you see that, okay, what is the chemical then? What is the chemical then that's a high hazard for me? Because if it's for extra dry skin, they're going to put something extra in there to moisturize your skin as well. So, doesn't mean all moisturizers that are out there aren't good for you, and you need them to keep your dry skin. It's just something we have to be aware of. And remember, one of the ways chemicals get into our body is through moisturizers or our skin, when they're absorbed through the skin. And then remember we talked about the accumulation effect. So if you just use it one time, it's probably not going to hurt you, but if you use it every day, 3 times a day, or whatever the case may be, then you start building up that accumulation, then it may have a negative impact on your particular organ, your respiratory system, etc. So, again, just another way of letting people know that there is information out there that can help guide you to it. Now, then they'll say, well, if I go to Whole Foods and get something organic, it's going to be like $10 more. That's true, right? It's going to be, and it's problematic, and that's very problematic for people that are living on a fixed income, or maybe low income, or don't have what we call that disposable income. So, what are some of the things what do you think would some of the comebacks you would have? Not comebacks, but how can we respond to that?
It will probably cost more to go to a dermatologist, get diagnosed with something in the future, and than buying a bottle of it.
It could, that's a good, because it, you know, if you end up with something that is even more long lasting, it could cost you more going to the physician, going to the doctor, going to the provider. Yeah. What else?
Only they can rinse their vegetables, something like that.
If it's on the vegetables with the pesticides that are used, rinsing some of those things, yeah.
They probably buy one in one and kind of interchange the test or
So you lower your risk by not maybe using the product as much. So that's one I've used quite a bit, is, you know, just being mindful of how you're using that, because if you accumulate that impact, it can have a negative impact on your body. But if you use it infrequently, then it's not going to be as hazardous for you, or the possibility is there as well. You know, the other thing is, how do we get them to help drive the prices down? You know, advocacy for it, voting, you know, getting out there and holding them accountable for that. Well, why can only people that have disposable incomes get them? What happens to us? You know, hopefully getting them involved in some of those environmental health issues that are also policy driven as well, is, you know, advocating for that. And the other is, you know, that's true, and you may not be able to buy that product, but it's important to be aware of that, particularly if you have children, and understanding how it can impact your children. So it's all a matter of raising that awareness, and then helping that person decide how might they resolve some of this issue, and guiding them in some of that. You may not always be successful, but you know, there are resources out there that can help. And then, are there ways they can make moisturizer at home? You know, can you make your own body lotion? You know, there are things on the internet where you can do it, where it's completely organic. You do it at home. Now, have you ever heard of Mom's Clean Air Force? Anybody ever heard of that? It's a nonprofit organization that is in all states around the union, and their focus is on mothers and getting mothers to understand what their children can be exposed to. And here in San Antonio, I don't know if anybody went this week. I couldn't because I was, what was I doing on Tuesday? I couldn't go, but they're having they're launching a program. Let's see if I can get that. It's called Eco Madres. Is anybody? Okay. So it's making an attempt to reach out to the most vulnerable populations, particularly here in San Antonio, Hispanic populations, and getting them to be advocates for air pollution, air quality, and getting involved in advocating for those issues. So this is an Eco Madres. This is a collaborative program between Green Latinos and Mom's Clean Air Force, trying to look for those. So that's a good resource as well around air pollution. What's in baby powder? Let's see if I thought I had it in here. No, just the picture. But Mom's Clean Air Force, in actual baby powder, how many people are aware that a big lawsuit was just settled within the last year that linked ovarian cancer in women to the use of baby powder near their reproductive system? And so there is a cause and effect there that actually the courts upheld between baby powder and ovarian cancer. So that's important, just to get people understanding it. Here's one that I show on BPA when I talk about that, where it comes from. It's linked to and safer options to plastics. And that means plastic bags as well. Plastic bags. Okay, so reducing exposures. Here's the last one. Most people now have your smartphones. So when you're buying and you're going shopping, there's a Healthy Living app that you can download onto your phone. And I'm going to the market. I'm going to download this app, I'm gonna take this app to the grocery store, I'm gonna look up this food or this product and see what they say about its hazard or non-hazard to me. So another quick and dirty little thing that can help you and give you some options. And then lastly, so also the environmental working group that we just talked about with the skin deep also has this little cheat sheet out there that I often give people a copy of in the community called the Dirty Dozen as well as the Clean Dozen. So the Dirty Dozen, when you talk about pesticides, and somebody here talked about pesticides, cleaning your fruits and vegetables. Well, these are the foods that we recommend that people stay away from or eat in smaller quantities. Grapes, cherry, apple, pear, potatoes, gosh, yeah. Strawberries, spinach, bell pepper, and these are the foods in which the pesticides are more easily absorbed into that are used, if it's not organic. And you're not necessarily going to buy organic because they can be so much more expensive, etc. But these are, when I pass this out, these are foods you want to maybe not always stay away from, but at least smaller quantities of them, as well as washing them very, very well. Washing them. Potatoes, I would recommend that if you eat the peels, it's very limited, the peels that you eat. So, Dirty Dozen, cheat sheet. And if you can, always buy organic, at least for these Dirty Dozen. Low pesticide foods. And we all love the avocados, right? Anybody here not like avocados? And I was so glad to see it on this list here. it's the low pesticide food. Peas, corn, eggplant, pineapples, sweet potatoes, cabbage, asparagus. Some of those foods can be a higher price, but then some of them are not. But that's what they call the clean dozen. So when you think about increasing fruits and vegetables, many times, because we're working with very low-income populations, it's very limited on how much of this they can buy, especially if the prices are high. But again, just that whole knowledge of maybe if I don't eat them every day, all day, or whatever, then I'm not having that accumulative effect in my body. And then always washing and cleaning as much as possible, and particularly peeling to get some of that the pesticide. Yes, ma'am?
Does it also apply to frozen foods and canned?
Frozen foods and canned, good question. No, it does not apply to that. No, and that would be a suggestion. It doesn't apply to that. The only thing you want to be careful of that is the salt, because if it's frozen or it's canned. But canned, you can wash those as well.
There must be something wrong with the can. What happens to the can?
Well, the coating of the can also has BPA in it. And that's what you see in a lot of times in the market, in the supermarkets now. They're getting away from cans, and a lot of things are coming in the plastic. But again, it's still BPA. Yeah. But some of them are now saying BPA free and things like that. So a lot of things out there to be cautious of, kind of, sort of. But also understanding how things get into our body can also help you make a decision about maybe lowering the hazard level in that. It's tough for me to stay away from strawberries every day, strawberries. Now, the things that you can, look at bananas, which are very popular with kids, bananas. Kiwi. Kiwi doesn't necessarily, sometimes they go with 3 or 4 for $1. Those are the kind of fruits you want to push. Onions, very healthy for you, as well as a very good clean product. Watermelon, very popular here as well, watermelon, so that's a good one. So it's not necessarily staying away from fresh fruits and vegetables, but being more aware of the ones that may be a bit more problematic, or in which you can buy organic. Yes, ma'am?
You spoke about washing. Is there a process to that? You use vinegar? You just rinse?
Rinsing it at this point, and scrubbing. Rinsing and scrubbing. Particularly with the issues like apple. And here, particularly with kids, if the apples are in that dirty dozen, but it would help a bit if you do peel them. You know, that's what's most exposed to the pesticide, if you can't peel those. The spinach, actually, a lot of the cases that we're seeing right now of staph and Listeria and all those other E. coli are coming from spinach. Yeah, so that kind of shows you that spinach can be really a very dirty product if that processing is not happening enough in those plastic, you know how they sell spinach now where it's all in a plastic and you don't have to peel it, you don't think you have to wash it, but that's where most of the issues are coming from E. coli and strep, and things like that. It's staph, I'm sorry, and Listeria. So it's in that process, like bluebell, that's where it's coming from. Bluebell, it's a processing of the ice cream. So peeling things can help, washing, scrubbing, but just being aware that how you can cut down and not eat them every day, or be more mindful of that, of what's there because of the pesticides. And if it's organic, that means they haven't used any pesticides at all. Okay, I think that was my last slide. Yeah, okay, questions? Yes, sir.
Well, it's more common. I was just reading recently, there was an article on the beginning of your slides about climate change and stuff. But, you know, it's kind of an uphill battle, especially with the politics that go into that. Because even like around 10 years ago, they were saying, you know, certain president and political administration at that time, they suddenly started changing the term to climate change and global warming. Because they said even suddenly when people say climate change, you know, they don't associate it with global warming, it's like it's more, that message comes across more, you know, in the sense that, you know, it's something negative. So, you know, I guess you just constantly have to, you know, just understand that. And even like, you know, the last previous head of the EPA, the whole politics that goes with it, you know.
And the thing that drives it being such a, in my opinion, the thing that drives it being such a political issue is the economic increase that comes from doing things that release the emissions in the air, like the oil and gas industry, driving, airplanes, forest fires. So one of the things that has contributed to forest fires is that we're now building homes and we're having people living in places they should not be living at, like in the Bastrop area, where that was all green trees and everything before they cut them down to move people. There were so many people moving in there. And so previously, before that, if a fire erupted in the forest, you just let it die itself out. But now you have to try to put it out because people are actually living there, you know, and it should. So a lot of the things that we've done in urban planning have contributed to some of those things that are contributing to our climate changing as well. So I think a lot of, in my opinion, the political angst is a lot of it is because that economic driver. And how do we minimize the impact on our economy and still be mindful of what we're doing to the earth as well. And that's where the green energy and the alternative sources of energy come in. So yeah, you're right, it's a hot button issue. And that's why I try to leave the politics out of that and trying to just get people to understand, because they can see it happening around us. We see that it's getting hotter. We see that there's more intense rain events. These hurricanes are becoming more problematic in the preceding year. So, you know, trying to stay out of it as much as possible, and that is how I try to really live against it. And the fact that you know, because as a nurse and we work with the community, and it's a message coming from myself and nurses, sometimes that's very helpful as well with community health workers and talking about that, because there's a trust level already built up, and you want to try to connect with that. I hope that answered the question. But it's a hot issue right now. You're right. Can cause a lot of arguments. Yes. Yes. Did you?
I just wanted to ask you if you could talk a little bit about how environmental changes are becoming a health equity or impact health equity.
Great. So when you think about equity, you think about what equity is that not everyone has reaped the benefits of economic growth and things, and other issues that raise up human potential. So there are many things in the climate and the way the climate is changing that's going to have the most negative effect on people in the lower income areas and people of color. So when you look at climate and equity and how do we make our cities more resilient to that, we need to understand that this population, which on the whole has contributed to climate change the least, are going to be impacted the most. So how do we equal that out? So how do we provide more resources for this community to become resilient, whereas myself, with the resources I have, the disposable income I have, would be able to take care of myself, but I also want to be able to take care of this group. So I think San Antonio has been doing a very good job in understanding that this is a population that deserves our attention and that we do need to put some resources into it because of our messaging, all the other ways that we need to do that. Maybe putting more urban canopies there, more trees there, more shade there to reduce their impact on climate change. So I hope that answers what you're saying now. Yeah. And in fact, in the climate action plan that San Antonio is doing right now, we have technical working groups, and I sit on the climate and equity working group. Is how do we do that in an equitable manner? Anything else? Yes, sir.
In your review of information, did you see anything that, I guess, sort of like quantify the time of exposure of these carcinogens,
Yeah,
how long
that's a good
should we
question.
expect, our patients to?
So that's a really good question. Thank you for bringing it up. So there are, throughout our lifespan, there are windows of opportunity. So windows that happen when things are going on in our body, which when they're exposed to a negative compound or a negative, can have adverse effects. So if you think about children from 0 to 2, that is when our brain is growing the most. So that's why if you're exposing children to lead in that age group, 0 to 2, that's when the most negative effects are going to happen. So if I were living in Flint, Michigan, and I was exposed to lead, it's not going to impact me negatively. It's going to be this population. So then you think about what's another window of opportunity is puberty. When the body is changing, I'm adding more endocrine through endocrine disrupting hormones, it's going to have more of a negative effect. So there are those times during our life when, as our body changes, that we need to be mindful of and have the most adverse effects from us. So that's when it's really very, very, it requires us to be very conscious of what we're exposing those kids to, particularly at the time when their brain is growing. We know that lead poisoning contributes to neural tube defects, developmental delays, and most importantly is it affects our executive functioning, our ability to make decisions, as well as lack of impulse control. So you see more criminal activity as these kids grow up. You see more substance abuse. You see more prison time because of that ability to not be able to control our impulses as much. Yeah. Does that?
Yeah, I have a follow-up question as well. In terms of pesticides, what are the greatest adverse effects that you're concerned about?
The greatest efforts I'm concerned about is the neural tube defects and the effects on my neurological system. Because then that impacts how people live, how people think, and are able to critically think. And that has a lot of impact on academic success, academic success, you have more an opportunity to earn higher incomes, have a successful life. You know, I see, being in public health, I see things from here and you know, all the consequences that come.
So does this data come from like some longitudinal studies?
For lead?
Yeah.
Yes.
Well, my question in general is, how is this data collected? Like, what kind of studies are being done? Like, for example, you talk about the pesticides and
Mhm.
percentages and I'm sure all of us in this room have been eating
Oh, yeah.
strawberries and so on and so forth for years. So I'm concerned in terms of, you know, what is my risk and what kind of data is there that can speak to that?
Mhm. That's a good question. Yeah, yeah. And so when you're looking at that type of data in terms of chemical exposure and the consequences of that, yes, you are going to see more longitudinal studies that have shown, most of it is not a cause and effect, it's an association. So,
Well, my question is with regards to studies that have been done and published.
oh, yeah, I mean, we can talk, I mean, I can give you a PubMed literature review on, say, if you want to know some of the systematic reviews on lead or systematic reviews on asbestos. Now, that's one of the ones that we know is a cause and effect, is that asbestos. Over time, we know we've had the fibers, yeah.
I know that data is out there,
Yeah.
asbestos, but I think I'm more or less concerned about these fruits and vegetables that you mentioned a moment ago. in
Yeah.
terms of that data, so.
Yeah, and the fruits and vegetables, remember, is linked to the pesticides that's being used. It's not the fruit and vegetable itself.
No, I understand
Yeah, okay.
that,
Yeah.
that's my question.
So that's why I say more bioorganic.
Yeah.
But,
Yeah.
yeah, and, I mean, you could do a PubMed search and
Because
you get some of
I know
those.
that pesticides are carcinogenic, I know that's not in the
Yeah.
literature, but again, that's
Yeah.
still a piece
Yeah.
that I'm concerned about. Have there been any cohort studies that
Yeah.
they do, or case control studies in terms of impact?
Oh, yeah, there definitely have been, and those case control studies then go to the EPA, and then the EPA then would put the regulations or no regulations, and, you know, you have to remember that the EPA, just like the gentleman said up there, it's a political body. A lot of times it's unfortunate, because many times the decision to ban something or to inform people about it will be driven by politics and not necessarily what the science is saying. So that's why it's good that you want to look at them for yourself. PubMed is a good one. The other one is free out there, Google Scholar. Because you just put the terms in and it pulls up all these systematic reviews.
I was gonna add to that, the CDC.gov is a fabulous.
CDC.gov, yeah.
It's very reliable.
Other questions? All right, thank you very much. I appreciate it.